should really hold my patients accountable to do before they get into your office? Does that help you, or would you rather see the injury early on?
I mean, I think especially for, let's say, the lower grade injuries, the grade 1s, I believe that, yeah, certainly you could see them initially, and I think even the patients themselves, even you as a patient, should know what RICE is, because that would be some of the things immediately that you could do to help reduce the inflammation that is seen afterwards.
And I'm always careful with compression as well, because I don't want a patient to also over compress, correct? Would I be correct in educating the patient that way? If, you know, we see all the patients come in with all these excessive things that they may buy at a pharmacy and excessive bandaging, you don't want to over compress either. Am I correct in doing that?
Right, exactly, and we'll see that very rarely, though. I think a lot of times they'll be applying ice,
okay,
maybe an ACE wrap, but if they wrap the ACE wrap a little too tight, the patient will usually
unwrap it. Okay. Exactly. I can't feel my foot. No, right, yeah, that's a problem, absolutely. So we're going to start talking a little bit about part of the treatment modalities. I'm a big believer with all musculoskeletal injuries about physical therapy. Mm-hmm. Sometimes I try to have patients go through a form of physical therapy, and I help them understand that it's part of the diagnostic process as well as the treatment process. If I send a patient to physical therapy, they're getting worse, mm-hmm, then they're going to go see Dr. Sangiovanni, right? So speak to us a little bit about rehabilitation. I believe we have a graphic for that as well, so that we can talk about what rehab should do and what kind of rehab can you start doing on your own.
Yeah, I think one of the movements we've seen nowadays is really early motion. Okay, so but it's somewhat protected motion within the plane that is a safe plane.
So I don't want to be on crutches all the time. Not like keeping off like what we call non-weight bearing. That's not necessarily the best idea.
Exactly. I would say oftentimes I let the patient kind of dictate like what their tolerance level is for the pain. So if they need crutches at first, then we usually will let them do that. But as quickly, soon afterwards, we want them to be able to put weight on it if it's an injury such as grade 1 or 2. And then also, like like I said, protected motion. So in a certain plane, we may not want them to be inverting their ankle initially.
Okay.
But they can still move it up and down. Okay, so we may have like a small brace or something for them to protect them, or a boot if it's a more severe injury.
And when they're actually in a physical therapy program, that tends to be pretty more elaborate than most patients perceive before they go to physical therapy, correct? Yes. So if you can give us a few about that. What would you want the physical therapist to work on?
Yeah, and initially in, let's say, the initial phase, we'll have the therapist work with you in terms of reducing a lot of the inflammation that you have. So using ice or other methods to really reduce that inflammation is important early on. And then following that, as let's say the ligament starts to heal, if it is a ligament tear, then we'll have them start doing strengthening exercises, and then balance exercises, what we call proprioception. It's a big word, but it's essentially your sense of where your body is in space, like balance. So these are things I think that would be helpful long term in terms of either prevention of other injuries and keeping you out of trouble.
Okay, great. So we're going to come back to the wannabe athlete here, and we're going to talk a little bit about what happens when the pain persists. So we have to take a break, but coming up, we'll address the problem of a persistent ankle pain after a sprain. You're watching the Health Channel, All Health All the Time. Our website, again, allhealthallthetime.com. Please feel free to log on and submit some questions. We'll be right back.
Like millions of Americans, Emma was living with high blood pressure and didn't know it. There were no early warning signs or symptoms. But Emma's heart was working overtime, putting her at risk for heart disease and stroke. Following a physical, Emma was diagnosed with high blood pressure, also called hypertension.
People of all backgrounds can develop high blood pressure. Treatments differ based on risk factors including age and family history. But hypertension can often be controlled with healthy habits and medication when necessary. Eating more fruits and vegetables, following a low-salt diet, exercising regularly, and quitting smoking are often the first lines of defense to control high blood pressure. Your doctor may prescribe one or more medications to help lower your blood pressure to normal. Some rid the body of extra sodium and water. Others reduce the heart rate or relax the blood vessels. Always take medications exactly as prescribed, and don't skip doses. While medications can effectively lower blood pressure when taken correctly, each type has potential side effects for some people. You might feel tired or have trouble sleeping. You may experience a dry cough, stuffy nose, leg cramps, frequent urination, or headaches. If you have side effects that don't go away with time, don't just quit taking your medication. Talk with your doctor and pharmacist, as there may be other medications or different doses that can control your blood pressure and have fewer or no side effects. Focus on the benefits. Taking your medication regularly will lower high blood pressure and protect your brain, heart, and kidneys from life-threatening consequences like stroke or heart attack, often the first scary signs of hypertension when left untreated. Control your blood pressure and reduce your risk by knowing your goal numbers
and monitoring your blood pressure at home or at your local pharmacy in between doctor's visits.
How's Franny?
She just graduated from obedience school.
Pharmacists play a key role in working with your physician to improve blood pressure management. We can address medication concerns and challenges. So talk to us about your treatments and goals outlined by your doctor. If taking your medication feels like a chore, don't just stop taking it. We can counsel you on working through side effects or determine when you need to see your doctor about possible changes in your medications. And we'll share healthy lifestyle tips to keep you on track. Whether you monitor your blood pressure at home or in the pharmacy, we're here to discuss your numbers and provide guidance. Okay, Emma, you're all set. I'll see you back here soon.
When the waves swell, the wind blows, and rain starts to pour, you'll ask yourself, how prepared or unprepared are you? Did you board your windows, protect your home? Secure loose objects so they won't blow away. Bring large items in and low items up. If you're properly prepared, it will help in a big way. Does your family have a plan? Do they know what to do? Is your emergency kit packed, waiting by the door for you? Just because you're not on the coast doesn't mean you're okay. Heavy winds and flooding can wash things away. When a hurricane is near, you need to stay safe. Turn on the radio. Wait for updates. Only leave your home if told so. Grab your bag and go, go, go. Now, if you're home and the heavy wind blows, get away from the windows, watch out for flooding, and protect yourself. You may be without power for a couple days, but your emergency kit should help you to stay. Once the storm is gone and it's safe to go home, be cautious of what's going on. If water's in your path, you have to turn back. Dangerous electricity and things you can't see can hurt you very badly. So before the waves swell, the wind blows, and rain starts to pour, get prepared, make a plan, and protect yourself each and every way.
Welcome back to the Health Channel, All Health All the Time. This is Dr. Manuel Torres, Baptist Health Primary Care, and I'm here today again with Dr. Sanjivani, who's an orthopedic surgeon from the Miami Orthopedics and Sports Medicine Institute. I wanted to make sure I got that right this time. So, Doc, we're going to go back to the Dr. Torres wannabe athlete here, and I want to elaborate as far as what happens if my pain continues. I've gone through rehab, I've gone through physical therapy, I've done all of those modalities, and definitely time has passed. And now we're in the sort of area of chronic pain, chronic discomfort in my ankle.
Sure.
How do you evaluate that patient? Where do we go with that patient?
Well, what we have to really evaluate is the source of that pain, right? So that pain may be either a combination of your initial injury, say. The pain may be from the development of what we call some degree of chronic instability, essentially that the ligament, your ligament may not have healed at the proper tension. So that ligament may be elongated or overstretched, not giving you the stability that you once had. Other things that we see quite commonly is that this was more than just a ligament tear or injury, that it may have also involved the tendon. Like we discussed before, the tendon is muscle to bone. And these structures work in unison with the ligament. And there could be a small split tear in the tendon, which may persist in terms of your pain. So those are things that we would focus on. Lastly, I would say that there are people that will have an ankle sprain or ankle ligament tear in combination with a cartilage injury, which once again cannot be seen on initial x-ray, but may play out later in terms of, let's say, persistent pain, and that's where we may get an MRI. And these are things that we have to kind of focus on in terms of the patient that has chronic pain after a sprain.
So if I got out on the court a little bit too early and tried to relive the younger days before your recommendations, before the PCP's recommendations, that's not a good idea. That can lead to chronic instability, chronic injuries, those kinds of things. Is that something that you see very commonly? Maybe returning to play a little bit too early?
Yeah, it's, that's one thing that we see, or returning to play, let's say when maybe they should have had like an ankle brace to start out with. So there's certain, when you return to, let's say, a desired activity such as a cutting sport, you may want to have some type of lace-up brace as well to kind of give you a little bit more stability before getting back until you feel very confident. That's why the physical therapy is very important too.
Exactly.
Initially,
The physical therapy can be sort of your extender. It can guide the patients. These are physical therapists. So commonly, I find with physical therapy as a whole is that patient perception may be that the physical therapist is sort of separated from the instruction of the doctor, and it's actually the other way around. We're pretty involved with the physical therapist. The physical therapist tries to communicate with us. This is how patient so-and-so is doing. This is what the expectations are and the functional goals, and either has or hasn't met those expectations. And that's very important for you to understand and our patient population to understand, so that hopefully you can help improve the communication, sometimes between primary care and specialist, and sometimes definitely between the physical therapist and the provider. So we have a graphic that I wanted to show about the chronic symptoms of ankle instability. So these are some of the symptoms around chronic pain.
So chronic ankle instability often will present with a history, let's say, of repeated ankle sprains or repeated twisting injuries on uneven surfaces. If there's a lot of instability, it could even be on flat surfaces, just by the way you're striking the ground or landing. Other things that we see with chronic instability would be persistent swelling or activity-related swelling, discomfort, which is usually on the outer portion of the ankle. Once again, pain or tenderness. Or the ankle, the patient just has a sense that they don't feel stable. They feel it's just not the same as it was prior to their injury. They're looking in front of them as they're walking because they're very conscious that they don't have the stability that they had before.
There you go. So that's very informative. And I hear a lot of, Doc, I've twisted my ankle so many times. I have loose ankles. And to me, that's a little bit of a red flag, like, wait a second, hold on, did you get misdiagnosed when you were younger? Did you not rehab properly? Is there an additional injury? So as a primary care physician, I hope that I'm doing the right thing and hopefully maybe putting them back in your hands or evaluating them again. Would that be the proper thing to do?
Yes, I mean, and even so, they may not even be you may not even be misdiagnosed. Right. It happens to be, let's say, the way your soft tissue may heal. We all heal a bit differently at times in terms of the type of collagen we lay down. So some of that is genetic. We know that people or have more laxity or looseness of their joints than others. So.
Okay, very good, very good. So we're going to introduce another video. This is a video that specifically about pain. It talks a lot more about how careful we need to be for pain. So let's take a look.
Pain-free does not mean normal. Just because it doesn't hurt doesn't mean that the tissue is back to its abilities as far as stabilizing and protecting and the strength and everything else. And we find that after injuries, there's a lot of things that get disrupted in the system of stability. So unless we train those back in, sometimes it doesn't get back in, then we're at risk for recurrent injury or repeat injury. There is an effect after an ankle sprain that's lasting on the muscle and on the balance system, the stability system. We always like to say the best brace you can give yourself is your muscle brace. But if the muscles aren't working together well, then it's not going to have as good a bracing effect. If you're aerobically fit, it doesn't mean necessarily you're stable. If you're flexible, doesn't mean you're stable. If you're strong, doesn't mean you're stable. So we train stability separately.
So that's a very informative video, and that is something that can sometimes tend to patient perception and affects patient perception of thinking that, well, there's nothing wrong, or I guess, I don't have pain anymore, so I'm okay. But that's not always the case, correct? We were talking a little bit about that while the video was rolling.
Yes.
We elaborate a little bit more on that?
Yeah, the patients will they'll get a sense. You'll get a sense of how stable your ankle is, and it can affect your daily activities. Could affect, let's say, your quality of life as you're going on vacation with your family and you're the last in the pack on the tour, or that you don't want to walk down that certain area to see that beautiful view because the ground is uneven. So there are definitely things, even let's say, that are not painful. It's just the instability that they see. Now, on the flip side of that, there are people that will continue to have pain. You may still have pain in a certain area, and that may be an indication that you have, once again, something more than just a ligament tear. One of the things, too, that we were talking about is, even though the initial treatment is most of the time is conservative or non-operative, right? And that even with a complete rupture of the ligament, that would be still the course of treatment initially, because we know that 80 to 85% of patients will not need surgery. They'll heal or they'll scar that ligament down to the right tension.
Okay.
But there's going to be sometimes close to 15% that may have persistent pain for some other reason. Let's say they have a increased soft tissue build